Good day, everyone, and welcome to today's special health conversation that is going to be brought to you by Mr Selfcare Initiative, where we promote men's health, family wellness, and community empowerment. Today, we are honored to be joined by a leader in HIV prevention and advocacy here in Uganda. That is Miss Mbabazi Martha Atai, the prevention program and advocacy coordinator at AHF Uganda Cares, the biggest HIV AIDS advocacy group in the world, like we are going to hear. We are proud that we are going to spotlight AHF Uganda Cares. AHF Uganda Cares is not just an organization, but it's one of the leaders when it comes to HIV and AIDS services in Uganda. AHF Uganda Cares is part of the large AIDS foundation on the global world that began all the way in 1987 here in Los Angeles, USA, and now actually works in over 40 countries worldwide. Wow, that is grace. In Uganda, AHF Uganda Cares has been serving communities for many years by providing free HIV testing, condoms, treatment, and prevention education. It has reached thousands of Ugandans through clinics, community outreach, and other various programs. Their mission is simple but powerful. That is to save lives, reduce new HIV infections, and ensure everyone actually has access to quality health care regardless of their background. Through this community engagement, advocacy, and prevention program, AHF Uganda Cares continues to empower Ugandans to their status, to know their status, practice safer sex, and take charge of their health. We are so honored on this page of Mr Selfcare to have this group actually come join us, because we believe they have rich knowledge when it comes to HIV/AIDS, sexually productive education, and all the other things that you've been asking us actually to discuss or talk about, but we couldn't because we didn't have people or guests with the knowledge that is going to come from the discussion that we are going to have. Here we believe that self-care starts with you. It starts with information. It starts with you knowing where you're supposed to go in case you're sick or in case you're not fine. And we are glad that we are having a very knowledgeable lady who has spared part of her night time today to come and actually enlighten us or give us a discussion about Uganda Cares, what they do, where they are formed, why they exist, and why they have been so integral or so vocal or focal when it comes to prevention of HIV/AIDS in Uganda. Because truly ending HIV starts with you today. Today's conversation is entitled Ending HIV/AIDS. It starts with you, and we are going to talk about the different services that are offered at Uganda Cares. Madam Mbabazi, thank you so much for joining us, and you are most welcome.
Thank you so much. I will call you Mr. Selfcare.
Yeah.
For having and hosting me tonight.
Yes.
I unfortunately wasn't picking you very clearly. I think either your network or mine is a little bit jumpy. But I'm honored to speak to the whole world tonight about AHF and the services that it offers and how far it has come and how far it's going. And it is definitely a great privilege to be sharing on what AHF has done over time. My name is Mbabazi Martha Atai.
Yes.
I am I work with AHF, where I coordinate HIV prevention and advocacy activities. And I joined AHF in 2008. And it's been a journey of experiences. It's been a journey of saving lives, and quite amazing. So AHF is
Um,
a not-for-profit service
yes.
provider
Mm.
founded in 1987 as a hospice provider. As you all know, then HIV treatment was not available, but all that had to happen was to reinstate hope amongst people that were infected with HIV, so that they could have a lease of life for some days extended. And so over time, AHF did the hospice, but in 2001, we had an AIDS conference here in Uganda, and the theme then was I Care, Do You? So a group of professionals that had come together in an organization met with the president of AIDS Healthcare Foundation, who had also come for the conference. And so they shared and got in touch with Ministry of Health. And so Uganda Cares was born out of the theme that year and through a collaboration with the Ministry of Health. And I want to say the rest is history. AHF has come a long way. We started our operations in 2002, and that was in Masaka Regional Referral Hospital in a small tent and a makeshift structure just to save lives. And we started by offering free ARVs. And AHF Uganda Cares was one of the first organizations to offer free ARVs in Uganda. As time went on, we realized the program realized that the people that needed ARVs were actually not coming forth. And so in 2008, we started a robust rapid testing program, and this was intended to identify people who are actually living with HIV, so that they could be enrolled in care. So the first step that AHF Uganda Cares took was to ensure that we test people, and we test people across the country. And this was enabled through working in partnerships with local organizations, call them CBOs and NGOs, that could reach far and wide where the lean staff of AHF could not reach. And in that way, we are able to identify quite many clients and enroll them into care. And then we also had a campaign, Testing Millions campaign. Again, we had to sign on a number of NGOs and CBOs to support the program, to reach out and test up to 1 million people, and identifying those who are positive and linking them into care. And of course, along the way, the challenge has been to ensure that we retain them in care. Oftentimes, we realize that there is a lot of loss to follow up, what we call loss to follow up. The clients disappear from care, and we cannot tell whether they are somewhere in another, service provision point or not, or just fallen out of care and, got back home because of a number of reasons. Yeah. So, but what is very important about AHF, our mission is cutting edge medicine regardless of ability to pay. So we are extending services to people, both those who are capable of paying for and those who are not capable of paying for. And all of them we give free quality HIV services. And we also offer, baseline tests that are necessary to understand a client's state of health before, enrolling them into care, which is a very good practice, because then it enables us to deal with certain underlying conditions just in case they are in a patient before we enroll them into care, so that we get good outcomes out of care. We currently we recently have had a steep scale up, and we have gone to we have expanded to the regional referral hospitals across the country. So while we have been in 3 regions, but not extensively, I can comfortably say that AHF Uganda Cares has now grown and is in 72 public facilities. And we also have centers of excellence that are 3 in number, and those are standalone facilities by AHF. So that enables us to take care of a cross section of clients, and just to ensure that we save lives. HIV is manageable, and so it is important that we have these services accessible to people that need them. And currently, in line with the policy of Uganda, we are doing what we call targeted testing. We map out areas of population subgroups that have high risk behaviors, high risk to HIV transmission, and so we reach out to them and offer them the service. We do this through outreaches, but also through a modality called index client testing, where when we get an HIV positive client, we request them to elicit their partners so that they get the quality of care that they need to ascertain whether they were exposed or not. And I just want to encourage everyone who is listening in that it is good for us to, respond to some of these interventions that are introduced by government, because they help us, to access services in time, because timely response to testing and linkage to care and treatment is very critical for good outcomes in healthcare. And so we do what we call index client testing. We
Yes.
elicit the partners from the clients, and then we are able to reach them out, notify them, and then encourage them to come over to the facility, or whatever their preference is, we find them where they are. So that is AHF for you.
Yes.
Recently, we also introduced what we call wellness centers, and these are basically intended to extend quality sexually transmitted infections screening and treatment. And all these services are free. These are non-judgmental, free, confidential services, just within a short time. And we have quite a very receptive, receptive staff in these wellness centers. We have one at Chitante. It's called Chitante Wellness Center. We have another in St. Valley Kudembe, right at the marketplace in Owino. And then we have the third in Kalungu, in Lukaya Trading Center, again at Lukaya Healthcare Center. You will be able to access quality services. Thank you.
Madam Martha, first of all, thank you so much for this beautiful elaboration about Uganda Cares. Surprisingly, I've been in the health sector for so long, serving in both Naguru Hospital and Mulago Emergency Department. And you just don't know the information out there about Uganda Cares, like we are missing a lot. So many people actually don't know what Uganda Cares does. And when you give all this history of when you started being one of the biggest HIV/AIDS organization, it is really amazing at what you've been able to do. Personally, working with patients, I clearly understand the role that these HIV/AIDS organization are playing in the country, and I want to thank you for the good work you and the organization are doing. Madam Martha, what inspired AHF to focus strongly on HIV prevention and men's health, like we've seen in so many of your campaigns?
Thank you very much. And I said that we work in collaboration with Ministry of Health. So we work within existing structures of the Ministry of Health. And because the question is why AHF has focused on HIV prevention and mainly looking at, reaching out to men. HIV prevention is very critical in our response to the HIV scourge, because once you achieve prevention, then the economies, I mean the resources that you would otherwise use on people that get infected with HIV will have been saved. And that is why we would like to re-echo the message of prevention as a very critical arm in the HIV response. And we want to encourage people to embrace prevention. And prevention has a number of strategies. I know when we just began as a country to respond to HIV, we started with the ABC strategy. And the ABC strategy is all about encouraging abstinence, especially amongst the young people, delaying sexual debut, and then being faithful for those that are in relationships, and then condom use in case you find yourself, derailing from your relationship, you're getting into another relationship whose status you don't know. We encourage that people must always remember to use a condom, because a condom is a triple prevention tool that will prevent HIV infection, it will prevent infection of other STIs, but also prevent unplanned pregnancies. So in that way, we will have hit 3 birds with 1 stone, and that is a condom for you. And we need to revamp and reinvigorate the conversation around the condom. The condom has recently been relegated because people, the users, the would-be users, have kind of gotten to let me say prefer other prevention technologies that are mainly drugs, and now we have the injectables that are the new prevention technologies. But one would wonder, somebody said, why would you, actually our president said, why would you take drugs for a disease that you don't have, and yet you could just simply use a condom and prevent an infection? So we want to encourage people that a condom still remains a pivotal tool in HIV prevention, and that people should embrace. And focus on men. It is common knowledge that men have very poor health-seeking behaviors. And so our focus on men has been ideally to ensure that we encourage them to know their status. I mean, anyone who knows that they can get into a relationship needs to first know their status, needs to know the status of the person that they are getting into a relationship with, because this is the only way that you can begin the journey of HIV prevention, by getting to know your status and protecting it. Once you know your status, then you're sure you're going to protect what you know. You know, oftentimes people could go for a condom, could go for PrEP, but they do not know what they are actually protecting. Chances are high that you could be HIV positive already, but because you've not tested first, then you don't get to know your status. So the first step is to know one's status. The second is, and my message to the men is that testing is power. So I want to encourage men to value HIV testing, because it will empower them with power. Power to take informed decisions or to make informed decisions. And then also they should know that it is their duty, it is their role to protect themselves and the other people around them, their spouses, their extramarital partners, but also they can do this by ensuring that they are tested, encouraging their partners also to get tested. And then I need to assure the men that treatment works. We all know that men have been this category of people that will assure the woman that because you're negative, then I'm also negative. Moreover, before testing. And then they are the same people who will poach on the drugs of the wife if the wife has started care and treatment. And this is very dangerous. It's not good to share medication. You need to get your own package, and the wife also takes her own package. That way, we'll have good outcomes from care. And then we need to reassure men to take control of their behaviors. It is very important that you make informed choices about your health, about your body. Let's not dive into anything in terms of behavior. Very critical. Thank you.
Thank you so much, Martha, about that rich discussion. Now that we've known actually what Uganda Care does and I mean the services you offer, your location, clearly, let us look at Uganda Cares and the community services and impact. What free services, what are some of the free services that that AHF Uganda Care actually currently provides to Ugandan? But Martha, simply, Martha?
Hello?
Yes. Simply, before you go to tell us the services that you offer, someone is asking me a question that they used
You're
to
breaking.
know. Oh, someone is
Mr. Selfcare, you're breaking.
Oh, can you hear me now?
Yes, now you're clear.
Someone is asking me that they used to know about Uganda Care. When did you add the AHF? Can you just in a minute explain that?
Yes, we had to add AHF, AIDS Healthcare Foundation, because we are an affiliate of AIDS Healthcare Foundation in Uganda. AIDS Healthcare Foundation is in about 55 countries globally. In Africa, there are 47. And so wherever AHF is, the acronym AHF has to begin and then the country follows. We are in Kenya, for example. There is AHF Kenya, there is AHF Tanzania, there is AHF Rwanda, there is AHF Zambia. The list is quite long. And like somebody recently kept on alluding to, Sarah is tall. I also would like to say AHF is tall in terms of service delivery.
Yeah, indeed, indeed, indeed. Okay, I was going to say indeed Sarah is tall, but whoever your Sarah is, make sure as you're watching you say something to compliment that lady. Your Sarah could be tall in terms of other things, but not height.
Network.
Yes. Martha, what are some of the
I can
services?
hardly hear you now.
Wow. I don't know. Can you hear me now?
Yes, please.
What are some of the services that the AHF Uganda currently provides in Uganda?
You're stuck?
what are some of the services that AHF is currently providing in Uganda today?
Hello.
Okay. Again, we are going to connect with Martha. We are making sure that our internet is good. But thank you so much for being part of this discussion. We are getting a great deal of knowledge from actually very knowledgeable people. And stay tuned. Leave your question in the comment section. I'm going to make sure that Martha answers all those questions we've been having around, especially Uganda Cares. I know all of you have heard about Uganda Care from that guy who said that when you mess around, you're going to be given tablets. There is that comment that people always used to make about Uganda Cares. But I'm telling you, Uganda Care is the great deal. For young people out there listening, Uganda Cares offers free condoms. I didn't know that actually these fancy condoms of Icon, of Love, are offered by Uganda Cares. They offer free testing and services. They offer free condoms. They offer free services when it comes to sexual reproductive health. But above all, they offer you that friendly services. I mean, I've been to some of these centers, especially the one in Ichitintali. Don't ask me what I'd gone there to do. Of course, I'd gone to check my status. I mean, how can you be serious in 2026 without knowing your status? So Martha is going to be connecting back, and we are going to continue this discussion, this rich discussion. But please share this with your family. Make sure you watch with someone. If you're home with a young person, please, please, if you
Hello.
thank you so much. Can you hear me now?
Yes, I faintly though. I had also dropped off.
Okay, it's okay. So again, if you're having young people in your house, just make sure you tune in
But I
everywhere.
don't hear you.
Oh, okay. I can though hear you very well.
Yes.
So Martha was asking currently,
Yeah,
what services are you offering in Uganda?
currently.
Currently, what services are you offering in Uganda?
Wow. Sorry, I
Okay.
can't hear you.
Um,
Please
can
come
you
again.
okay. So there is a private chat on your screen that you can can you hear me, Martha, now?
I'm trying, but you keep breaking.
Okay. Can you kind of tell us what services that AHF currently offers in Uganda?
Pardon?
What services does AHF Uganda Cares currently offer in Uganda?
Okay. The core services that AHF offers in Uganda
Mm.
include HIV prevention services. Under HIV prevention, we have testing, HIV testing, then care and treatment. Within the care and treatment package, um, we do have baseline tests that we carry out for
Mm.
all the patients that are enrolled into care. Before enrollment, we carry out certain baseline tests to be able to offer the best of quality service. And then we also offer TB services. We offer STI screening services. We do offer hepatitis B screening. And then we also offer cervical cancer screening. And we do referral. We do HIV counseling, and we provide food for health for patients that really are screened to be failing on care because of lack of food. We provide them some food packages to enable them go through their, drug regimens successfully. So basically, those are the main But we also do we do training for health workers to ensure that they are up to date with information and knowledge. We also do a lot of advocacy. Advocacy may not be a service, but it's one of our core, areas of programming. Yeah, that is, and condom programming is another core service. Condom distribution is one of the core activities or services that we offer, and we provide and distribute to the last mile free condoms and free but beautifully branded condoms, and very much appreciated by community. And so what happens is that we map out hotspots and we deliver these condoms. But we've also empowered some hotspots to pick up the condoms from office so that somehow we can build a level of sustainability in ensuring last mile distribution of condoms, people who need them.
Okay. Martha, someone is asking, where can people access these clinics, outreaches, or community programs?
Come again?
Where can people in Uganda actually access these services or clinics? Where can people come if they need to get services of Uganda Care, AHF Uganda Cares?
Now, because we work in collaboration with the Ministry of Health, we encourage clients to go and seek services at the nearest facility to them, because we know that at times transport challenges can affect the retention of clients. So once they are able to get services from the nearest point where they are, it is good. It is still a service offered. But of course, we would like to encourage our clients to seek services at our facilities because of the quality of service offered. And so we have, like I mentioned, we are working in the existing Ministry of Health public facilities, and there are 72 of them. We are across the country. If I began from Kabale, I would say we are in Kabale, we are in Barara Regional Kabale Regional Referral, Mbarara Regional Referral Hospital. We come to Rubale, Chitwe. We are in Rugara. We are in Itojo. We are in Lyantonde. We are in Rakai. We are in Masaka. We are in Kalungu. We are in Bukomansimbi. We are in Kampala. We are in Tororo. We are in Mbale. We are in Jinja. We are in Soroti. We are in Lira. We are in Gulu.
Wow.
But we are everywhere. AHF, we are in Fort Portal. We are in Hoima. The list equivalent to the different service points across the country.
Martha, again, to all our viewers that are watching in, this is very important. This is one reason why we actually started at this page of Mr. Selfcare. My background
Mr.
is...
Selfcare, please speak up.
Martha, I think it's your network. I can hear you very well, though. Yes.
Am I not clear as I speak?
No, you're very clear. You're very clear. Yes. So again, I was saying that to people watching in from wherever you're watching from, I come from a background. Wow. Martha, you're fine. I come from a background of losing parents, of surviving in ICU because of taking on decisions, or because of me failing to take on certain decisions. I lose my parents due to diseases that actually were preventable. I lose my brother in a road traffic accident. I'm a survivor of COVID-19 ICU. So ever since God gave me a chance to go through all these terrible things, I put it upon myself to pass out information using all the available social media channels. So to someone watching out tonight, you're so lucky that you're listening in from Martha. who has been at the forefront of fighting, of making sure that we carry on the global mandate of reducing HIV/AIDS infections globally. Count yourself lucky if you're watching in tonight. But again, we don't charge a penny for people to watch in these episodes of Mr. Self-Care. That's why I kind of ask you to watch this with someone. Share this with your young people. Let them know where they can go for services to seek help. Martha, back to you. As in prevention and advocacy, which is your role in Uganda Care on a daily, what does your role involve in your organization? What do you actually do? Oh,
Thank you. Uh, as a prevention and advocacy coordinator, developing and implementing prevention programs based on strategies that are high yielding, and building partnerships with stakeholders and communities. So we work with other like-minded organizations in implementing and reaching out to services to people that need them. Other IPs, other community-based organizations that mobilize and then also are able to follow up for the clients that we offer services. We also work with community in itself in raising awareness about HIV prevention. We have a structure at community level called the Community Power Voice. Now, this Community Power Voice ensures that they get to understand the issues that affect the clients within their communities in terms of access to services, in terms of adherence to care and treatment, in terms of retention, in terms of stigma, because stigma is one issue that has disabled, retention in care and treatment. So once the CPVs are able to understand these concerns, then we support them to create awareness, to educate the communities, and encourage them to get back in care and, and get retained in care for good outcomes. I also do advocate policies that support prevention efforts. Policies like the HIV prevention, the HIV prevention policy, then the HIV stigma and discrimination guidelines. We also try to ensure that we have the implementation uh, done, and then also coordinating outreach and education activities in communities, in schools, targeting young people, working with young people and having them take the lead. For example, AHF, we have the Girls Act program, and then we have the Young People's program. These programs are primary prevention programs, and these programs help us to mobilize risk of HIV infections as a result of the environment they live in, as a result of poverty, as a result of generally behavior. So the young people listen to their peers more than they listen to. So we engage the young people, we equip them with knowledge and information. They reach out to their peers, transfer this information, and also distribute condoms to young people. And that way, we tap in.
wherever you're watching us from, thank you so much for being part of this wonderful audience. We are hosting Uganda Cares today, and we are going to be every Wednesday to talk about HIV/AIDS. We want to help the young people in making very informed decisions when it comes to their sexual health. We are going to discuss different topics. We are going to discuss different topics when it comes to HIV, and today we are privileged that we are talking from the Advocacy and Programs Coordinator, Uganda Care, AHF Uganda Care. Very knowledgeable about the subject matter that we are talking about. For all along, people have been asking me, please, Mr. Selfcare, talk about HIV/AIDS. But you know, when it comes to HIV, you must have updated information. Otherwise, HIV literature or information is changing almost every day. And we can only talk about it if we have updated information. And I'm glad that this time around, AHF Uganda Cares has given us an opportunity here at Mr. Selfcare every Wednesday to have someone come and talk about HIV. And I'm excited by the number of turn up, the number of followings and the number of comments that are actually coming on. Remember, this show is live on X right now, is live on Facebook, and is live on YouTube. Next weekend actually is also going to be live on TikTok at the same time. So the goal is to pass out as much information as possible about HIV/AIDS to the public such that everyone makes informed decision. Can you believe that in 2026, as I speak today, there are people still getting HIV/AIDS, and yet we have condoms, and yet we have drugs like PrEP, and yet we have drugs like PrEP that you can take before sleeping with someone you suspect, PrEP that you take after sleeping with someone you suspect. But in this era, you're still having young people, men and women, actually still contracting HIV/AIDS. Can you imagine, as in 2026, we still have people that sleep with people whose status they have not tested? As long as we still have that one infection that still happens due to things that I will call reckless or something, then this program is timely and valid to make sure that we have it. Yes, Martha, you're welcome. And can you hear me? Yes, Martha, can you hear me? Martha, can you hear me?
Hello.
Yes, I can hear you.
Hey, please come again.
I can hear you very well. Can you hear me now? Martha, can you hear me?
The network is letting us down. Sorry.
I can hear you very, very well. I can hear you very well. I can hear you very well.
I can now hear you too.
Okay, that is good. So, Martha, let's talk about prevention now, especially the use of condoms and HIV testing. How is this important in ending HIV?
I did not hear the question very clearly.
Okay.
Is it testing?
Yes.
Okay. Testing is part of the solution to ending HIV because one, you get to know your status. And once you get to know your status, then you're able to plan well your life, how you're going to live it. You are able to disclose your status to your loved ones and the circle around you of your loved ones. You are able to support your partners to also seek the service, and you are also able to support your peers in staying healthy. That is point number one about testing, and therefore we say testing is power, because once you get to know your status through testing, then you are able to make very powerful decisions as a human being. You are either able to go and start seeking care and treatment, or if you're negative, then you're going to be very careful about how you conduct yourself, about the behaviors that predispose anyone to HIV infection. And therefore, you should be able to stay informed. You know, when you get tested, you get to know your status, you stay informed about how you can live positively but productive, remain productive as a human being, about how you can remain negative by changing your behaviors. If you had predisposing behaviors, you should be able to learn to adopt behaviors that can keep you protected from HIV. And one of such behaviors is consistent and correct condom use, being faithful to one tested partner, and also, abstinence. Even adults abstain, by the way. You can do what we call secondary abstinence in case you really, assess your life and you see that it was not necessary to have, first of all, gotten into sexual activity in the first place. You consider to, rethink your position and abstain for a while as you uh, make up your mind and take a decision on who that Mr. or Miss Right will be in your life. Yeah, so it is important to test. Test very, very important. And it helps you to take control and make informed choices about your health and your body, basically.
Okay. Again, if you're watching, I kindly ask you to subscribe. When you subscribe, you give YouTube a chance and the power to share this video with so many people. But again, most importantly, make sure you leave a comment in there. You leave us a comment
Okay,
in there.
thank you. I would like to thank you for hosting me, and just to emphasize the services that AHF Uganda Cares offers: HIV testing, treatment and care for those who are diagnosed with HIV. We also distribute condoms. We test for STIs and treat them. And by the way, our services are quality and free. And so we would like to encourage people to reach out to the different locations where we are. I already informed about the Uganda Cares Dr. Charles Farthing Clinic at plot 54B on Chira Road. And it's the same location where you'll find the Chitante Wellness Center. But also to take care of the market vendors who never have time to seek health services. We have a market-based clinic in St. Balikudembe, just adjacent to the market, opposite the entrance where the police post is. You'll get St. Balikudembe Market Clinic there. It will also offer HIV testing. It will offer you treatment and care. It will offer you STI screening and treatment. It will give you the condoms that you need to protect yourself. It will you for cervical cancer, hepatitis B, and others. It will also screen you for TB. TB is also a very critical condition that, if not diagnosed early and managed, a co-infection with HIV, just in case you're already infected. And once the two get hold of you, your health outcomes will be very, very bad. So we encourage people to screen for TB, especially people in the markets. They live in dusty places, dusty environments. Children in schools are normally very crowded. They need to be screened for TB and started on preventative treatment early in time. And so, having said that, AHF definitely works with young people through peer education they reach out to their colleagues and their peers and give them information, educate them on safer sex behaviors and HIV prevention. Youth-friendly services are available. We have youth corners in all the facilities we are. And then we also have community engagements by young people in their different chapters, where we bring in community gatekeepers, we bring in other structures like cultural leaders, religious leaders, because HIV no longer a disease that you can manage alone. It needs a multi-sectoral approach to be able to manage HIV, and it begins at the family unit. It begins at the family unit, goes to the community, goes to other stakeholders, up to national level, as we generate responses to fight HIV. And of course, not forgetting the use of digital platforms, especially by young people, to communicate messages, prevention messages. That is one area that we are really capitalizing in, because we know young people are very, very present in social media platforms. So the moment we use those social media platforms, we are sure that the HIV prevention message is getting to the targeted young people. And most importantly, hyping up advocacy on by promoting policies that support youth access to health services is the other aspect that we do. And this we do in partnership with other organizations, in partnership with the Ministry of Health, in partnership with Uganda AIDS Commission, in partnership with religious leaders, cultural leaders, so that as we get together as one, we are able to handle the situation as one. And we hopefully look forward to a future where HIV will be no more, because as we do the last mile, we want to ensure that there are no more new HIV infections in our country, in our communities. I say this for God and my country.
Thank you so much, Martha, for these wonderful deliberations and for taking off your busy schedule to be with us today. We want to let Martha go and have a rest. Thank you so much. And we shall be willing to host you another time to give us a wonderful discussion. Thank you so much and have yourself a good night. Now we are going to be joined in by another representative still from AHF Uganda Care to try to go through a few questions that you've asked. Thank you so much, Martha, and have yourself a good night. Yes, Bridget. Bridget, can you unmute yourself? Yes, Bridget. Good evening. Bridget, can you hear me? Yes, unmute yourself. Unmute yourself. Okay. Again, we are going to have Bridget respond to a few of our questions. But again, so far it's a good discussion that we are having. Please leave all your questions about HIV or about Uganda Cares. Tell us stories you've heard about Uganda Cares, and then we want them to clear the myth. We want them to throw more information. We want to make it as informative as possible. as informative as possible to make sure that we can add on their drive or on their campaign to actually try to make sure we don't have any new infection. Yes, Bridget, can you hear me now?
Yes, please, I can hear you. Thank you so much.
Good. Thank you so much for joining us. How have you been?
I've been good, thank you. It's a great show that you're having tonight, and we are happy to be part of this amazing talk as AHF Uganda Cares, as our mission to ensure that we provide HIV treatment services to everyone, regardless of the ability to pay. So we are very excited to be part of this show, and I thank you so much for hosting us.
Can I start with one myth that I always had about people that work in HIV organizations? So when I was at medical school, there is this young girl that I used to admire, but was working with one of the HIV/AIDS organization, and someone told us that before those people get the jobs there, they first test them, and then they must be positive to work there. Bridget, clear this. Is this true or not? Yes or no?
Like you said, that's a myth.
No, I want you to clear it.
I am actually clearing it because not everyone who works in an HIV-based organization is HIV positive, and they're not tested first for them to be given a job, and so that is actually a myth. And actually, I also remember growing up, there would be like those. I remember at that time there was TASO, and they would say that everyone who was working in TASO was HIV positive, but that wasn't true, and so it is just because I think because as you meet the counselors, the health workers who work on those that tested or those that come for testing, and maybe some of them test positive, and because we want to ensure that we are part of the journey, and so as health workers are talking to, they also put themselves in your shoes, and so as they're like talking and they're like, of course you're a health worker, I know some of these things, and someone will be like, we are in this together, we shall be taking our treatment, and so because they use that statement it would make people think that okay, they are also taking medication.
So actually, when you say we, for us, we took the we personally, and so okay, Bridget, back to the discussion. You working with AHF Uganda Cares every day. What
Yes.
challenge do you normally face when encouraging young people, especially men, to test for HIV or use condoms?
I think like Martha previously said that men have a very poor seeking health behavior, and so sometimes it's very challenging for you to convince men to come for testing, and so one of the things that we usually fewer men and fewer boys that come for these services, and so it's a bit challenging, but we have so many now programs that we are using to ensure that we have now these men and we have the boys that come on board and get these services to men that has these young boys that are in the communities. We got young boys that are in the universities. We go to even these other young boys that are in other key population areas to come and seek these services. And sometimes as AHF, we go to their communities where they are based in and we provide these services to them. And so this is one of the things that AHF has ensured that we keep supporting men to ensure that they come and seek these services.
Okay, Martha, I've lost your video. You can go off and get on again.
You aren't hearing me?
I can hear you, but I've lost your video. Okay, so again, that is Martha from Uganda Cares. We shall make sure we have the last bits of this program, and then yeah. We are, yes, first time, you know, technology, yes, they should be able to, we should be able to have, oops.
I actually thought you had put me off.
Okay, so, okay. So yes, also I have Bridget and Martha. Okay, so okay. So I was asking Bridget. Bridget, how does Uganda Care work with young people and the communities to promote safe sex and responsible health choices?
Am I audible?
Yes, you are.
Thank you so much. Like Martha had said previously, Uganda Cares has programs that support young people. We have the Girls Act program that brings together girls of different communities. As AHF, for example, in Uganda, we are in 5 regions where we're supporting these girls to seek services. And so this program community able to support their fellow young people with information, and as they are meeting in their chapters, we are able to also find them there and to provide services. And they also gather these young people to come for the services at the facilities. And also part of the programs we also have, we have the program called Boys to Men. And the Boys to Men program also does the same work that Girls Act program does, where we have young boys that are champions in their communities, and these young boys mobilize their fellow young boys to come for these services. And we also have the young people's program that is also in the facilities, where some of these young people are actually in the facilities and they are supporting their fellow young people. For example, when they come for HIV testing services, they are able to seek these services, and they are able to be counseled by a few young people, because you find like in a facility there's a young person who is also maybe HIV positive and is on treatment, and so when the other one comes in and tests positive, is able to receive counseling, is able to receive a lived experience from this other young person that has been in the facility. And so we have programs that are really strong for young people, and we have youth-friendly centers where when young people come for the services, they're able to be, talked to by their fellow young people, and they will find that safe space for them to access the services without being judged. I remember growing up, I would fear like going to a doctor because I would think I cannot express myself because he would judge me, or he or she would judge me. But now when I step into a facility and I find my fellow young person holding my hand and is like, you know what, Bridget, come and go here, takes my weight and then takes me to a doctor, I'll feel free and I'll be able to express myself and talk about the things that are affecting me as a young person. And so HF has ensured that we have a young people friendly environment for them to come for these services and able to access services without any fear of judgment or any fear of discrimination. Thank you.
Martha, over to you. What message do you have for men actually who fear to go for HIV testing?
Thank you very much. Like I mentioned earlier, that men, being the heads of family, need to take lead in accessing services. Men are known to have very poor health-seeking behaviors, and we need to target them, and we need to put up deliberate, activities that target men. We have used sports in the past, but I think we need to go beyond that. We need to engage men through different platforms like social media, have webinars, have community dialogues, just to encourage men and get to know which are their points of convergence that we can target them from and be able to access them, educate them, create awareness, and bring the service where they are. It is very critical. Men are the ones who have the money. The young girls don't have the money. The men are targeting young girls in hostels. And these are not just men anyhow. These are married men. And I would like to rally you, Mr. Self-Care, to
Yes.
join us in this Kawefube, to reach out
Yes.
to the men.
Yes.
We need to rally men to seek services, to embrace prevention. Because a young girl will tell you, the man came, he did not even ask for a test, he did not even seek for a condom. And what could I do? What could I do? She did not have any option. She just had to go in with a guy. And this is a married man coming from his home. He's going back home. We are seated on a time bomb, and we need to quickly, grab the men and bring light to them and let them know that they can still live safer once they embrace condoms and use them consistently and correctly. Because there are again these people who will use a condom 1, 2, 3 times and then they get to trust each other. But I think we are okay. We can, in the meantime, put these condoms aside. And it is during such opportunities that HIV is transmitted. So if you choose to use a condom, it should be consistent until when you've got a trusted, tested partner, then you
Okay.
can put aside a condom.
I
And
think
that
the
is in
main,
terms of HIV prevention and the
yeah,
other STIs. Yeah.
yeah, I think the men watching this show have always emphasized that it is our responsibility to take a lead when it comes to healthcare. We always want to be respected. We always want our women to submit to us. But in the way of submitting, let us also be good leaders. Let us lead when it comes to HIV, AIDS. I mean, if all the men watching in today were responsible about HIV, I'm telling you, the target of 2030 with no new HIV infections will be a reality. So men, I urge you to join me, Mr. Selfcare. I promise today to be part of this global movement of making sure we control HIV infection and working as suit with AHF Uganda Cares actually to make sure we promote their content to make sure that I use all my social media platform to push this message forward. Martha, before we close in a few minutes, let's talk about couples. How can couples support each other knowing their HIV status and actually staying healthy?
Thank you very much. We actually encourage, and the policy encourages that couples need to test together. They need to get to know their status together. And whatever the outcomes, they should be supported to deal with the outcome together as a couple so that they are able to support each other in whatever the outcome it is. We used to have a program which has really slowed down the couple testing modality of testing. And here there was a campaign encouraging couples to go and test together. If you were around, you should have seen signposts at facilities which were reading couple counseling and testing. Get to know together, get to test, get to know together. But I think that intervention has since been abandoned. But we want to still encourage people, once they are in a relationship, get to test together. Again, I would like to encourage men. And men, I'm not just judging you, but I have had experiences with men. They are the ones who will assure the women who have very poor negotiation skills. They will assure them how they are tested, how they are negative, and then these women end up giving themselves in only to find out later that they have been infected. So men, first of all, need to be true to themselves. They need to take control of the epidemic by testing, by changing behavior, and by adhering to treatment. In case they are found to be HIV positive, they need to seek treatment, they need to adhere to it. Yeah, and they need to support their spouses. In case a spouse is infected, those people need love. They don't cease to need love because they are HIV infected. They remain human beings, normal, and in any case, sexually active. So what is very important is to know how to prevent transmission from the infected partner to the non-infected partner. The couples we call the discordant couples, where one is infected and the other is not infected. There are so many factors that explain such a result or a status. But what is important is to accept that it is actually true. One of you is positive, the other is negative. If within a short time you had sexual interactions, we normally advise that the negative partner tests again after 1 month. Once we test and we found you still negative, then we declare you negative. Once we test and we find you positive, we counsel you and also enroll you into care and treatment. And then together, you are able to walk a journey. You become treatment supports to one another as a couple, so that each reminds the other to take their medication. Each reminds the other to change behaviors, adopt positive behaviors that can, support the quality of life in both of you, but also ensure that you live productive lives as a couple. Thank you.
Again, thank you so much, Martha, for that. Now, let's go to the practical things. If there is someone that is watching in today that wants to get tested tomorrow, what should they do and where should they go?
If there is someone following us right now and they need to be tested and they have not been tested in the last 1 year, and yet they have been doing things, I would like to refer them first to AHF facility on Chira Road, plot 54B. You will find the best of healthcare. Go to Naguru Hospital in case you're around Nakawa. Go to Naguru Hospital. You'll find the testing point in the art clinic, and you'll be tested. It's not the art clinic, it's the chronic care clinic now. So go there and you'll be provided the best of the service. If you're around Kisenyi, you're around Kafumbe Mukasa, please go to St. Ibali Kudembe and you'll be offered quality service. If you're in Masaka, go to Masaka Regional Referral Hospital and you'll find the best of healthcare there. If you are in Gombe, in your Butambala, if you are in Butambala, go to Gombe Hospital and you'll be offered a quality service. If you're in Gomba, go to Madu Health Center 4 and you'll be offered a service. If you're in Nakaseke, go to Nakaseke Hospital. You'll be offered the quality services that you need. If you're in Katikamu, around there, go to Katikamu Health Center 3, and you'll be offered the services. If you are in Luero, go to Luero Hospital, and the service will be provided free of charge. If you're in Masindi, go to Masindi General Hospital. If you're in Gulu, go to Gulu Regional Referral Hospital, go to Awach Health Center 4, go to Atiak Health Center, go to Pabo Health Center. If you're in Kitgum, go to Kitgum General Hospital. Go to St. Joseph's Hospital. Go to Namokora Health Center 3. All those are facilities that we are supporting, and you'll get a quality HIV service. If you go the other side of Western Uganda, go to Lyantonde, go to Rakai Hospital, Lyantonde Hospital, go to Mbarara Hospital, go to Ntungamo Hospital, go to Itojo Hospital, go to Rashameire Health Center 4, go to Rubale Health Center 4, go to Chitwe Health Center 4, go to Ntungamo Health Center 4. Further beyond that, you will go to Kabale Health Center 4. Soon we shall be in Entebbe, live and kicking, offering services in Entebbe Grade B Hospital. And then we are also in Jinja, regional referral. We will be in Kayunga this year, and then we'll be in Mukono, and we shall be, we already in Mbale. You can seek services there. We are in Busia, we are in Tororo Hospital, we are in Nagongera Health Center 4, we are in Mulanda Health Center 4, we are in Masafu, we are in Busia Health Hospital, we are in Malaba Health Center 3, we are in Soroti Regional Referral Hospital, we are in Serere Health Center 4, we are in Atutur Hospital, we are in Kumi Hospital. The list is long, but yes, if you're listening and following, please rush there first thing in the morning, and we'll be glad to receive you and offer you the service. Thank you.
Lastly, Martha, before we go into our questions that have come in from the young people, I was a guilty president at the medical school, and one of the things that we used to suffer with was shortage of condoms. Martha, if there is a guilty president there or a minister of health at a certain university that wants to pick condoms, because one of my responsibility was to make sure Makere Medical School was safe. But by then I didn't know about Uganda Cares, and one of the things that we used to suffer with was condoms. By then the condom that we used to give our colleagues and friends at university were pink. But I'm glad these days through AHF Uganda Cares, I mean, the package of condoms you're having look cute. I look at the love condom, the icon. I mean, they are good. They're better than the pink one we used to get. Martha, where can these health ministers from universities pick condoms from? Who is the contact person? Where should they come?
Thank you very much, Mr. Selfcare. The guild presidents actually are already picking condoms from AHF Uganda Cares. I've been a contact person, and at facility level, there is a counselor who actually receives them and gives them the condoms. So Makera University have always picked condoms. KIU have always picked condoms. Chambogo University have picked condoms. So we are remaining with universities like St. Lawrence that have not really fully come on board. But we've been to their universities also in a campaign. We had a campaign together with MC Cats, which took us around all these universities. And as we went, we actually left condoms. So this year, we are also running a condom campaign. And we are certainly going to work with the student communities, the young people at different institutions of learning, young people at community level, to ensure that the gospel according to condom use is sunken into the minds of especially the young people, but also other populations at risk, to ensure that people get to value the condom and believe that it can save them at a certain point in time.
Martha, as we conclude, how can we support or partner with AHF Uganda Care to make sure the goal of 2030 of not having new infections of HIV actually is made a reality? How can we partner? in our different capacities and the people watching right now?
Um, Partnership is our niche. We value partnerships. We value working in partnerships, and we do welcome partnerships. For as long as we see in you the potential to actually do a good job. For example, if you're able to mobilize, if you're able to create awareness in the community, we can, we can partner and ensure that together we are able to achieve the goal of no new infections or zero new infections by 2030, zero death to HIV related conditions or AIDS related conditions, no morbidity, no sickness related to AIDS. We want to completely chase away AIDS. We want to end death related to AIDS, and also we want to end new HIV infections in our environments. So it is possible to partner. AHF is open to partnerships because it is where the strength lies. Yeah.
Yes, Martha, lastly, as Mr. Self-Care and an advocate of self-care, how does AHF Uganda Care align with self-care that I always preach about here?
Yeah, it is totally well aligned because self-care, if I understand it very well, is taking the responsibility personally to ensure that you remain healthy. You attain your health outcomes out of your personal, your personal effort. So we are well aligned, Mr. Self-Care. When you look at the ability of someone to determine that they need to take an HIV test and rightly go and seek the service, and after get the counseling and testing and you're handed a positive result, it doesn't help keeping in denial, or getting back home and saying, no, I cannot believe that I'm HIV positive. It is good that you accept and immediately start your treatment in time, because the earlier you begin care and treatment, the better for you, the better the outcomes of your health. So self-care is very
Mm.
critical. People need to take charge.
Mm.
Yeah, we have mobilized, we have
Mm.
created awareness, we have
Mm.
cancelled. It is high time that with all the information and knowledge, people
Mm.
take up this responsibility and avoid transmitting HIV to the
Mm.
unsuspecting partners.
Mm.
They need to avoid, you know, avoiding care by
Mm.
keeping away. They need to stop stigmatizing those who are HIV positive, but
Mm.
also stigmatizing those who may have had predisposing behaviors by branding them HIV positive and therefore making them scared of seeking services.
Mm.
It is good to embrace each and every person in community and encourage them to
Mm.
seek services. Know your status, you'll be able to protect yourself meaningfully. If you don't know your status, you're wasting time to wear a condom when you do not know your status. So
Yeah.
it begins with getting to know your status. Once you get
Mm.
to know your status, then you are sure of protecting yourself and the others around you. You will get to be able to control or take control of your health and body. Yeah? Get to
Okay.
test for STIs, because STIs are facilitators to HIV transmission. Once you treat STIs, then the route through which HIV would be transmitted sexually because of the existence of STIs would be closed. So we would have narrowed down the the chances of HIV transmission by treating off STIs. So let's come together, fight HIV, fight STIs, end new HIV infections, and AIDS-related death, and sicknesses related to AIDS, and let's have a healthy, productive population by 2030.
Okay, Martha, before we call it a night and a day, let's go through our viewers' comments. Let's start with Diana. Diana said this is a great discussion. Thank you so much, Diana, for watching. This is Maureen. Maureen is saying this is beautiful. Thank you so much, Maureen. This is Phoebe from Busia. You're saying you're watching from Busia. Thank you so much. Sportymetrics is saying, wow, amazing discussion. Thank you so much, Uganda Cares. You saved my family. Now, Sportymetrics, we may need to hear more soon to host you to tell us how Uganda Cares saved your family. That should be an interesting story. Bridget is saying, okay, Bridget is saying, okay, Maureen has a question. How many times do you test as a couple after the first test? Do you want to respond to this?
Thank you very much. Testing as a couple, if you tested the first time and you're negative, during the counseling session, you have to draw a plan together with supported by the counselor on how you're going to move on with your lives as a couple, especially if there were no predisposing factors in the recent past, say 2 to 3 months. So if you didn't have any predisposing behavior and you're given a negative result, then you're sure you're negative. If you are tested and you're discordant, one of you is positive, the other is negative, the negative partner definitely has to get back and test to confirm if they are truly negative or they were on window period. Window period is a point, a time between point of infection and detection of the antibodies in your blood. So you have to test again after 4 to 5 weeks to ascertain whether you are actually negative or you seroconverted and you're now HIV positive. Yeah. Okay. And if you're both positive, then no need to test again. Please don't waste resources. We are now living in a time when we are real resource constrained as a result of donor cuts. So once you're tested, you're HIV positive, don't move from one service provider to another and believing that you are trying to confirm whether you're really HIV positive. Start treatment immediately so that you are able to live, a quality life. I think I've responded to that question.
Okay, yeah, you've responded well to that question. And okay, where was that? Where did that question? Okay, so Ronald is saying beautiful discussion. Thank you, Martha. Okay. This one is saying thank you so much, Martha, for the presentation with Chimbo. This is tremendous. I have a simple question. How do you handle issues of discordant couples? I think you can shortly go about this. I think this will be a topic of its own where we shall have a discussion, because this is a question that keeps coming in my. I think we should plan to have a full day, a full discussion talking about discordance. So
discussion on discordance.
Yes. So whoever asked this, keep watching. One of these Wednesday, we are going to have a full discussion on discordant couples, because it is something that is confusing within the medical and non-medical professionals. So I'm going to keep this for a later discussion. The same person is also asking, we see much increase in HIV new infection, LTFTs and GBV. Please share something, how you're supporting the GBVs. Do you want to give something on GBV? A small insight?
Yeah. Thank you so much for your question. GBV is one of the predisposing factor or facilitating factor in HIV transmission. When you're living an abusive relationship, when they introduced the female condom, what they call the FC2, they said that you can even wear it 8 hours before the sexual interaction, so that even you who has a partner who is a drunkard, he will always come back rushing, but fine when you are equipped with your condom. But I tell you, the men will always drag that condom out and force you into unprotected sex. Moreover, before preparing you, and for as long as you're not prepared for a sexual interaction, then you are going to get bruised, and if the other one is infected, then you're highly likely to get infected as well. So GBV plays a very, very critical role in facilitating HIV transmissions. Yeah, beating, forcing one to have a carnal relationship without their being ready is detrimental. So
Okay.
GBV is an issue that we need to address as a family, as community, yeah, by ensuring that the laws that are existent are actually implemented or enforced. For example, GBV in terms of forcing a girl to get married to an elder man, you know, and then he basically uses her as a tool without recognizing her right to consent is also another aspect that fuels HIV transmission, especially amongst young people.
Okay,
Yeah.
thank you so much. Martha Maureen is saying, okay. Olivia is saying, I love this show. Olivia is saying, the show is very education and compassion are powerful tools in fighting HIV/AIDS. I totally agree. Maureen is talking about abstinence and giving a thumb. Yes, we believe in abstinence, even secondary abstinence. We shall have a topic talk about abstinence in young people here, and we shall have young people actually from AHF Uganda Care, youth educators to come and share this. We really want to make this tool informative and as inclusive as possible. Alinda Anita is saying, thank you so much for this educative show. Thank you so much, Anita, for watching. Olivia is saying, growing up in Kampala, HIV is very abundant. Yes, it is abundant everywhere, even in Western Uganda and all parts. So we just need to keep on the same bandwagon, on the same bus, to make sure we support those in advocacy, to make sure actually we can slow down the infection. Okay. Again, Olivia is asking, and testing. Is testing for free? If not, how much do I need?
Thank you, Olivia. Like I mentioned earlier, testing services, care and treatment are free services from AHF.
Yes.
Even at the public facilities, HIV testing, treatment, and care are free services. So please rush there and seek a service and save your health.
Okay. So Bridget is saying condoms give triple protection against HIV, STIs, and unplanned pregnancies. That is so true. Then someone is saying HIV. Okay. And then lastly, someone is saying we pretty appreciate the awareness. Thank you so much for friends that have been that have interacted in the comment section, and those that are going to watch this show after we've gone. Someone, before I ask Martha to come in and give our last remarks about the program, someone asked where I pick my interest actually in talking about self-care and in spending my time to invite different experts and professionals to come and talk about this. I lost my mother due to cervical cancer at the age of 43. I lost my father due to alcohol. I lost my lovely brother due to a road traffic accident. I've lost close relatives due to HIV. I remember one of the painful stories that I shared is one who came when I was at medical school, just got a good job in UEB. A very young man sent to the islands to do. And then eventually, you know what happens on the islands? I think he gets HIV AIDS. 6 months onto the job, he comes to Mulago. I take him to Tasso there for testing. And when they told him he was positive, he ended his life after 3 weeks. His own life, he ended it because he couldn't face the reality of struggling so much in family, and then eventually getting HIV on his first employment trip to Kalangal Islands. So I come from a background of pain, of seeing people that have died due to things that are totally preventable. I believe if then there was enough information about cervical cancer, my mom wouldn't have died. Should be in her 60s, mid 60s. I know so many people in their mid 60s that are still working. If someone had passed on enough information about alcohol, my father would not have died. And I'm not scared or afraid of talking about this, because it is actually what inspired me to join the medical world, but also never to take alcohol, and also to be as vocal as possible when it comes to passing out healthcare information. Now, you could be there watching, but you're suffering from depression. I know so many families. One of them, my friend recently in papers, who is a medical doctor, whose wife suffered from a postpartum depression. And the church leaders thought it was witchcraft, so they kept her in one church in Kampala, took her off the medicine. And these two people have separated because of a postpartum depression that went bad. I know a family last week that called me in Uganda, a wife who had pulmonary TB from Lugazi, poorly managed, and now is admitted in ICU in Mulago because the lady can't breathe. This is a young couple of 37-something years. So when I speak about this, it comes from pain of loved ones and friends I've seen around me that are suffering in 2026, or that have lost lives due to preventable or manageable things. So my call to everyone watching in, this video about HIV may seem so simple, may seem so basic to you. You could be asking yourself, why should they waste 1 hour and 40 minutes talking about HIV AIDS? But I want to ask you to pause, go to your favorite tool, that is your phone, and ask it how many people are getting infected every day in Uganda. Ask your ChatGPT or Google the age range. You're going to be surprised. Young people, married people. Because you would assume the marrieds are safe. So many people are still getting HIV every day. I'm tired of seeing friends and close families actually die of things that I could have talked about. That's why I and Martha spent 140 minutes plus Bridget, who came in shortly, to make sure we emphasize. If you find this video useful, please share it as widely as possible. I've already shared discussions here that the people that have benefited from these productions are never in my target. Are people that I've never met, are people that I don't know, but they call you saying someone shared this in a church WhatsApp group. Someone shared this in a political group, and I picked this information and it helped me be part of this great journey. I asked Martha a simple question of how can we support AHF Uganda Cares? And she gave her answers. I want to remind you, The only way you can support Martha and I in this journey of making sure we achieve our HIV/AIDS target of 2030 is by forwarding this video in all the social group. Put it on your status. You just don't know who is going to benefit from this information. It could be your child. It could be your husband who is so stubborn to visiting healthcare facilities. It could be your husband. It could save the life of the very important people in your life. So join me, Mr. Self-Care and AHF Uganda every Wednesday in making sure we make our place a safe place. If we pass this information to the men, then your daughters are safe. I'm talking to you, the men. You could be one man playing with another person's daughter, but your neighbor, that man, is playing with your daughter too, unknowingly. So the earlier we pass on this information and make our environment safer, the better for everyone. Again, I want to thank AHF Uganda Care for the great work you're doing in Uganda. Us who read around, we know how you've been at the forefront of making sure we still have HIV negative girls to marry, because that is very important. I mean, if they are not there, we are not going to marry. So thank you so much. We applaud you and thank you. I also want to thank the Minister of Health for partnering, for giving a chance for genuine partners like AHF Uganda Cares to play their part in making sure people are safe, and we also add something to actually making HIV infection history in Uganda. We thank the partners that partner with AHF Uganda Care, because definitely there is money involved. There is money involved. So all the donors that are partnering with AHF Uganda Care, thank you so much. You're putting your money in the right place. And as a person that has grown up from the deepest villages in Uganda, Katente, Nkokonjeru, all the way to Naguru to Mulago, I know what this organization has done. Please don't give up. Inject more money, support them on more programs. I'm telling you, the 2030 goal is realistic, is achievable if all of us do what we are supposed to do. Martha, what are your last remarks for someone watching in, and you send greetings to your lovely family as we close this show?
Thank you very much, Mr. Self-Care. As an addition, I also wanted to pass on a message to the young people. The young people now play around with words and say HIV is like Musuja, but I tell you, Musuja, you have a simple dose of 5 days and you're done with the medication. But for HIV, it is a whole lifelong treatment. You cannot break it. And once you break it, then you develop complications, then you go to the second line and third line. Recently, right from the time of the executive order, a lot of clients who are on third line have suffered looking for medication. The medicine gets stocked out and they are running from one facility to another. I have personally been trying to coordinate for some of them to get the medication from, but it's been a tough journey. And so the safer you are, the better. You'd rather avoid exposing yourself to HIV infection because times are not the same now. Medications themselves are also getting limited. And I want to discourage you from thinking that HIV is like any musuja. Please, if you can avoid exposing yourself to HIV infection, please do. But if you're HIV infected, again, hurry and get to seek care and treatment. I want to thank you, Mr. Self-Care. I thank Diana and Tim for connecting us. And I want to look forward to more of these conversations. And I want to pray that these conversations we hold here will touch very many souls that are following us and will definitely cause impact in the lives of so many and change people from promiscuity to celibacy almost, and living responsible lives and self-care. I want to also send out my regards to my family that has had to keep awake as I engage in this conversation. I really pray that it has been a meaningful engagement, and picking from the conversation that is already flowing, it indeed is a space that we should capitalize on and ensure that we reach out to people far and wide, and we shall be counted on from what will have impacted in people's lives. Thank you so much, Mr. Chimbowa, for giving in your time to be part of this effort to push to the last mile of ending new HIV infections in our communities. Thank you so much, and have a blessed day. May God bless you and bless us all.
Okay. Thank you so much. The comments I'm getting on all social medias, on Facebook, again, I said we're live on Facebook, we've been live on X, are just encouraging. Someone is saying we should have actually this with the young people. Yes, I'm going to work with AHF, especially the youth department. The good thing, the program coordinator, Martha, is here. To see if we can actually have a youth session where we invite youth peer educators on Saturday during the day. We don't want to engage them at night. We can have their live session on Saturday at 10 a.m. and actually have this discussion about HIV. I know they are receptive. We are going to make sure we make this a safe place for young people to talk about HIV and all reproductive health. Again, thank you so much for everyone watching. Thank you so much, Mbabazi, for sharing your time and knowledge with us today. We've learned that actually AHF Uganda Cares offer free HIV testing, condoms, treatment, and community education across Uganda. And that is actually ending HIV with each one of us. To everyone watching in, know your status, use condoms correctly and consistently, encourage your partner and friends also to test. Seek treatment in time. To the men, your life matters. Just like we want to take lead in politics, in football, let's take lead in preventing HIV/AIDS. This target and goal of 2030, to me, I take it upon myself as a man and as fellow men watching in. If we only did our part, I'm telling you, the ladies will fall suit. So join me, fellow men watching, to make this a reality. And from all of us at Mr. Selfcare, thank you so much for joining today's discussion. Please let the conversation continue in the comment section. We shall pick out those questions and respond to them in our next episode. See you next week on Wednesday, 9:30 p.m. with another presentation around subject matter. Stay protected, stay informed. Self-care starts with you, and self-care is self-love. Have yourself a blessed night, a blessed day, a blessed afternoon, wherever you're watching us from. Bye.
Bye. Thank you.